At the age of 8, I was diagnosed with type 1 diabetes, or juvenile diabetes. And at that time, my doctor prescribed 2 forms of physical activities. His diagnosis was that if we could go ahead and treat the diabetes by active exercising, that we could control some of the other conditions that are associated with diabetes, such as heart-related conditions, diabetic neuropathy, diabetic retinopathy. And so he prescribed 2 types of exercise therapy. One included swimming, and the other one included horseback riding. And so, as you can see today, I've continued that prescription. So that's something that I attribute to my health. Almost 40 years since that diagnosis. And so again, back then, that was in the 80s, it was the treatment of horses used for physical therapy was actually a relatively new form of treatment therapy. In fact, it took my parents some time to actually find some type of treatment center. And I really didn't know anything about it as an 8-year-old. So my mother sent me to a camp that actually had a therapy program. And I didn't know that it was therapy. I just enjoyed horses. But I soon learned that I physically felt better. And that's one thing that I've learned along the way. And then continued that form of therapy. Unfortunately, one of the things my parents found is outside of the summer therapy program, there weren't a lot of therapists at the time. In fact, my first therapist was actually a nurse that was from overseas. So she actually did nursing and did some form of therapy overseas in France. And really, honestly, that's where equine therapy really came from, is overseas. So we were a little bit behind here in America with that form of therapy. Today, you will find centers everywhere. So we are so fortunate to have those possibilities. But I was lucky that my mother was able to, almost 40 years ago, to find that therapy. I have gone and spoken to different diabetic programs, and one of the things I will say is that I will attribute that active exercise on top of my horse has really helped me as a diabetic. And has helped me to stay healthy, to try to avoid some of the complications associated with diabetes, and to continue thriving. So I attribute a lot of my health to my horse, along with some swimming too. Again, we can see that those programs are really expanding, and so now you can see a lot of youth being able to have those opportunities in equine therapy.